All right, so let's go ahead and get started. Hi, everyone. Welcome or welcome back if you've joined us for a previous session. This is our communications training series for community leaders. I am Jacqueline Dalton, the director of the Health Equity Community Collaborative, and I'll be your moderator for today's session. This is part two of our three-part training series, and for this series, we are really using feedback that we've gotten from you all previously. And so our intent is really with these sessions to strengthen how we communicate, inform, advocate, connect in today's increasingly and quite polarizing and rapidly changing as well environment. So in part one, if you joined us, you saw that we explored some foundations of health communication. We talked about trusted building, active listening, and practical messaging, as well as storytelling frameworks. And afterwards, we saw that there was really an appetite for more tools, some more resources, and talking about different ways to engage in conversation on very challenging topics, some public health, some community health issues. So that's what we're here to do today. And just real quick, for those of you who are new to the HECC, if this is your first time hearing about the Health Equity Community Collaborative or joining us for our webinars, we are a collaborative of local and national partners. This is community-based workforce partners, public health partners, folks who are health equity advocates. And we are really born out of the idea that no one organization or institution can do it all alone. Or can combat health inequities alone. And so everything that we do is really grounded and centered in collective care, shared power, and equity-driven change through activities like the session that we are hosting today. So again, welcome. So in our, so the first thing that we want to do today, and please forgive me, I'm having a glitch with my screen. So I am wanting to go to the next slide, if we can do that. Excellent. So what you see on your screen are our different housekeeping things that we want to go over today. And those things include one, having the closed captioning. So if you would like to use that, just press the CC button at the bottom of your screen. If you want to engage with us, as many of you are already doing, we welcome you to do that through the chat feature and throughout the session. Feel free to put in comments, reactions, resources. We do have a Q&A function, so if you want us specifically to see your question, please use that Q&A function, and our team behind the scenes will capture that question so we can respond to that during the session today. Also, we welcome you to be interactive in our session when we do have those times, but otherwise we ask you to stay on mute. For this session, we will not allow any AI note takers. However, we are recording today's session, so you will receive the recording after the training today, and everything that we share today will be shared with you after in a follow-up. All right, excellent. And so let's move on. One thing that we like to do as well is to share our practice agreements. And so this is something that we like to do because we do have times to interact with one another. We ask that you do your best in using these practice agreements throughout the time that you are in small groups with one another. So we do ask that you create space for all participants to be present and participate. We ask that you acknowledge systems of domination, whether that's racism or capitalism, patriarchy and colonialism, and all the ideologies that those things maintain. We welcome you to be welcoming and affirming, to hold space for one another, tensions, right? So sometimes we don't agree with one another, but that's totally fine. We ask that you lean in with curiosity, ask questions, be kind to one another, and also to foster space for belonging and healing as well. And so, as I was talking about in today's session, we're going a little bit deeper. So we'll introduce some real world or day-to-day communications tools. We'll talk about practicing and leading with values and exploring how to break through some of that polarization, some of those political divides with some connection through your communications. Um, and let's see, I know one of the things today, um, excellent, thank you. As we jump into introducing our speakers today, I wanted to mention that we know that there are many challenges for community-based organizations. Some of those challenges include misinformation, information overload, just the erosion of trust within the public health sector overall. We are constantly sort of bombarded with information, whether that be through social media or other news outlets. Um, and, sometimes folks have the capacity to have a communications team and to develop a communication strategy, but sometimes those strategies are not there. And so that's what some of our speakers are going to be addressing some of these things today through our tools that we are presenting. And so our presenters today include Guia, who is the CEO of ChangeLab Solutions, Ashley Lawrence, a policy associate at the Legal Defense Fund, Sue McCarron, Vice President of Strategic Communications at Health Leads, Sadena Thevarajah, who is the Managing Director at HealthBegins, Natashia Townsend, who's the Programs Director and Policy and Power Building Policy and Power Building at HealthBegins. And those are the speakers that we'll be hearing from today. So before we pass it over to our first presenters, who will be Sadna and Natasha, we do have a little poll. We wanted to take a time to really get the pulse in the room, to do a quick poll and to see how you're feeling about your communications capacity at your team, within your team and within your organization. So you'll see a couple of questions pop up. And those questions are asking, how confident are you in your organization's skill and capacity building around communications? And we also have another question around, what are some of the most pressing issues that communities need to know about or better understand in the area that you serve? All right. I am seeing that primarily, I don't know if we'll keep it going for just a moment, but for the most part, as I'm looking at the results, we have about 44% of folks just right there in the middle, as far as their confidence of being able to address communications in their organization. We have about 8% at a 5, 30% at 4, and there is about 20% at a 2 or a 1. So we're a little bit across the board today. I'll say it's a bell-shaped curve for my statistics folks, but most of everyone is sort of at a level 3. And then some of those pressing issues, I'm not able to see that in the poll right now. So I do welcome you to share in the chat. I am really excited about getting into some of our presentations today. So as I mentioned, we're going to go ahead and shift it over to our speakers today. And so we're going to start off with Sadna Thevarajah and Natasha from HealthBegins.
Thanks so much, Jacqueline.
Yeah.
Thank you. It's always so great being in HECC hosted spaces, and so I'm really grateful to be here with all of you today. So my name's Sadena Thevarajah. I'm managing director and a partner at HealthBegins, and I had the privilege to speak within an HECC hosted space this summer. And to talk a little bit about the Health Equity Policy Hub in that meeting. And so some of you may have been in that room as well. But what I was hoping to do with, just about 5 minutes here is to do a little level setting on our Health Equity Policy Hub. I'll put it up on screen in a second, and we'll drop the link in chat as well. But want to just give you some of the why of why we built this tool, as well as how folks can use it before I turn it over to my colleague, Natashia Townsend, who will hone in on communication strategies more specifically. in that previous conversation we held through HECC, I think some of the themes that came up was the recognition that we're in this moment where the current administration is pursuing policies that erode democracy and is concentrating power among a small elite. You know, this shift resembles oligarchy or authoritarianism, and these are systems that benefit the wealthiest at the expense of everyone else. And a core strategy is to make it so that we don't name what's happening for what it is, and also to erode institutions that protect public accountability, rights, and shared civic life. And so we delved into that a little bit more in that session. But I mention it here because we try to name it in every space that we're able to, because we are able to. And so I wanted to kind of level set with that, and also abiding by HECC's practices to acknowledge the systems of domination that exist. As you know, early as January, as many of you did as well, you know, we quickly became aware of the anxiety, the overwhelm, the intentional kind of pushing of executive orders and other types of executive actions that were really debilitating our partners, our clients, and ourselves to kind of keep us from engaging meaningfully in a democratic process. And what we wanted to do was convert some of that kind of energy into agency. And so we launched this Health Equity Policy Hub, and I'll drop the link in here, or maybe Brianna, if you could drop the link in here now while I share screen with the website. So we launched this Health Equity Policy Hub with that intention. You know, how can we support ourselves, our friends, our colleagues, our communities, our partners to do some sense making of the moment, and also to convert what's happening into something that we can take control over and exert some authority over. So right now there are two parts to the Health Equity Policy Hub: a policy tracker and a mobilization network. The policy tracker is intended to help make sense of some of those federal executive actions that impact health equity. Since the time we launched this a couple of months ago, people have been asking us for state-based trackers or for issue-based trackers because they're finding value in this. We're getting lots of great feedback on how people are using this for their grant proposals or just to kind of understand what's happening. And I'll kind of go to one of our early cards that we created to show you what's in the power of these. So one of our early cards was related to the sensitive locations rescission, where ICE was now allowed to enter hospitals and health systems. And so what we do here is we give a very simple summary, understanding that most of the health professionals that are accessing the site aren't trying to get well versed in every single policy, but are trying to just wrap their heads around what's happening. So we provide a simple summary, simple impact analysis, and then we offer ways for folks to take institutional action. In this case, you know, we had published a blog right around that time because of how acute the need was. We've seen this persist, but we've also seen a number of other resources come up. And in this Take Institutional Action section, our desire was to help institutions recognize that it's not only like Know Your Rights trainings or those types of offerings that could be what they offer to their constituencies and to their workforce and to their communities, but there are actual policies that institutions can take on, like creating separate public-private waiting rooms and not allowing entrance for law enforcement into that private waiting room. You can train staff, have trained staff where there's a single member who's allowed to speak to law enforcement, and that's part of your policy. So there are ways to exert agency even within this kind of this action that took place. This one was an executive action. It was a memo in Department of Homeland Security, but that type of thing is what we're trying to engender here, and really offer ways for folks to go back to their institutions, go back to their organizations, and think more expansively about how they can respond in this moment. So all of these cards not only help you understand what is happening in the moment, but also what you can do about it, and give some ideas and language for you to approach others in your organization about it. The second piece is a mobilization network. And this was designed because we recognized that a number of people needed to be in community with others to really pressure test some of those ideas and some of the ways that they could move forward. And so we created this space for folks to either launch their own group or to be able to um, be a liaison with an existing group that they already have. So this is the public view of all of the groups that have formed since. Some folks have created groups, but they're private. And so you don't see this on this map. But what it allows is for health professionals who are interested in really stepping up to the moment and doing some community organizing around health equity themes to be able to do that. What we offer is at the least a 20-minute call when folks sign up to orient them to what we're doing and to also offer some starter tips for them to launch their groups. And then we have monthly spaces where we problem solve, troubleshoot, provide trainings or expert kind of feedback on what they're doing. And we also partner with other organizations where their existing trainings are offered to Mobilization Network members. So the first one we did was in partnership with People Power Health, who offers an amazing 6-week training for health professionals who are new to community organizing, which was a perfect fit. And we got really great feedback from running that training in partnership with them over the summer. So I just wanted to kind of level set on what the Health Equity Policy Hub is. And I'm going to, in a second here, turn it to my colleague, Natashia Townsend, who's the newest member of our team. She is leading up our policy and power building programs practice area. And I want to say I'm so thrilled that she's leading this part of our work. She is an expert at building coalitions, shaping community organization strategies, and developing programs that bridge policy advocacy and community impact. She's held legislative entities to account and has really been a great powerhouse for the state of Arizona as well as nationally. And so I'm thrilled to introduce Natashia to be able to talk a little bit more about communication strategies in particular.
Thank you so much, Sadena, for sharing about the Health Equity Policy Hub and for all of your kind words. But really, Sadena is the visionary behind the Health Equity Policy Hub. And at HealthBegins, I am the newest member and the Programs Director of Policy and Power Building. And we have really been able to position the Health Equity Policy Hub as a vehicle of collective power to enhance policy advocacy work that's being done across different regions. And as somebody who has a background in scaling community-based programs in the health justice space, I want to emphasize today the power of shared narratives as a comm strategy. And because the Health Equity Policy Hub is a national initiative, shared narratives have really worked well for us when it comes to community organizing, spreading our message, and growing our base of support. But before I get into that, I would like to request that you all participate in a 2-question poll. It should pop up on your screen in just a moment, and I'll give you all some time to answer that. The first question is your organization currently engaged in policy advocacy? And if so, what is the best communications tool or strategy that seems to work in keeping your members or customers informed about policy changes that affect them? Awesome. And as you all are answering that poll, I'll dive a little bit deeper into how shared narrative building has helped us spread our message and awareness for health equity and policy advocacy. And also, if you all are able to see the results, you may pick up on some strategies that I do not talk about in this moment. But oftentimes we overlook shared narrative building while we're doing outreach, whether digitally or in person, because usually our goal is to tell potential participants or customers about who we are, what we're doing, and how we can serve them. But sometimes we forget that talking about our partnerships in particular can enhance our messaging and help that participant or customer better connect the dots when deciding to sign up or walk away, especially if you are a smaller organization. So when it comes to community organizing or even building support in terms of future funding, you want to be able to create shared narratives on social media, during your speaking engagements, while you're networking at conferences. That's extremely important because it's a method of storytelling that relies on repetition to explain who you are, what you're fighting for, and also why it matters in the first place. It also connects personal experiences to enhance the meaning of your shared goals. It builds a collective identity, which is the most important part, that retains your volunteers, that retains your customers, it retains your participants in your programs. And then also it highlights the importance of partnership. And so, with that said, when you're building a shared narrative with strategic partners, it means that you are taking the time to amplify the collective voice around an issue that you are working on. And it also increases credibility of your joint effort or your campaign. And then lastly, it builds trust with the community that you're focusing on. So whether that is a participant in your program or the community at large, it's building trust with those communities. And so what I'd like is for everybody to ask yourself when you're creating your comm strategies, how can you enhance your message by lifting up the partnerships that you have? And also, as we are building out the Health Equity Policy Hub, we are always actively seeking new partners who are aligned with us. And because that is one of our go-to strategies, it works out really well as we are expanding across different regions. And so with that, I will pass it back over to HECC. Thank you, everyone.
Excellent. Thank you, Natasha and Sadna. It's really great to hear from you all and just to hear some of the progress that's happening with the health policy tracker and mobilization tool that you all are doing. So really appreciate seeing that, and thanks for the poll and everyone that participated in that poll as well. And I wanted to just take a moment before we go to our next presenter to go back to some of the things that we saw in our initial poll. I had a chance to look at some of the responses, and forgive me, in the moment, I was not, I would say my capacity for functioning with Zoom was not where it needs to be when I was looking for those responses. But I was able to look at some of the responses that you all shared when it came to some of the pressing issues and needs that you all are seeing. And we saw things, it was a mix of things from chronic disease management to preventative health measures like vaccines and water fluoridation. We also see vaccine concerns like the vaccine recommendations, Medicaid cuts and eligibility as far as it relates to policies and systems, as well as the differences in things happening at the federal level. So federal level policy versus state level policy for things like Medicaid and SNAP. And then we also saw some things around access and resources. So access to housing, healthcare, childcare, some resource limitations. We also saw that some individuals said that you have shut down some of your communications since the second administration or the second phase of Trump administration has started. So really just not focusing a lot on communication. So some reduced communication capacity in that regard. Because of the limited resources and some of the other ways you all are limited. We also saw some issues around language barriers. So translating some of the technical language, some additional lack of culturally tailored translations, and then some trust issues as it relates to just the political and social climate as well. So I just wanted to share some of that with you all and appreciate those responses as well. Um, and again, thank you to Sada and Natasha for talking about the health policy tracker. And I really do encourage you all to visit their website, check it out, check out those resources. There's some great things and great information on that website as well. And I believe our team put that into the chat. Now we're going to transition over to our guest presenter, Ashley Lawrence from the Legal Defense Fund. Earlier this year, we worked with the Legal Defense Fund to develop a resource around myths and facts. And so Ashley's going to talk a little bit about that resource today. So Ashley, I'm going to pass it over to you.
Okay, sorry about that. Hi,
No
good
problem.
afternoon, everyone. Thank you all for joining. My name is Ashley Lawrence from the Legal Defense Fund, and today I'll be walking through recent guidance from our organization on health equity with a focus on dispelling myths that have arisen due to new executive orders, clarifying what remains lawful, and considering practical steps we can take moving forward. As a disclaimer, as an employee of LDF, I'm not giving legal advice. And additionally, please note that this is a highly individualized, program-specific and fact-specific approach. So, why does health equity matter? To set the stage, as you all know too well, disparities in health outcomes by race, ethnicity, socioeconomic status, language, disability, gender identity, and citizenship are not new, but they remain deeply entrenched. For example, infant mortality, pregnancy-related deaths, chronic diseases like diabetes and cancer, and access to both mental health and reproductive health care are significantly worse for people of color than they are for their white counterparts. These disparities are rooted in historical exclusionary practices and discriminatory policies, which continue to have structural effects on housing, education, the environment, and access to care. Therefore, health equity is not just about access, but also about addressing systemic issues. It matters morally, economically, and legally. Health equity matters because it is about ensuring that everyone, regardless of race, ethnicity, income, gender, disability, or immigration status, has a fair and just opportunity to attain their highest level of health. Today, stark disparities continue to exist. Black women are three times more likely to die from pregnancy-related causes. Low-income communities face higher rates of chronic illnesses, and LGBTQ plus people experience barriers to affirming care, and undocumented individuals are often excluded from insurance coverage. These inequities are not the result of individual choices alone, but of a systemic factor such as discriminatory policies, unequal access to education and housing, environmental hazards, and bias in medical care. So not only is this a moral imperative, but also for social and economic reasons. Healthier populations mean stronger workforces, lower healthcare costs, and more resilient communities. When systems close gaps in access and outcomes, they not only save lives, but also advance fairness, strengthen democracy, and reduce long-term burdens on public resources. In short, health equity is both a matter of justice and a practical necessity for a thriving, inclusive society. Next slide, please. You can go to the next slide as well. Yes, okay, great, thank you. So I'm going to talk a little bit about the executive orders that were introduced or issued by this current administration. Several of the executive orders have sparked concern among health equity professionals, and they are ending radical and wasteful DEI programs and preferencing, ending illegal discrimination and restoring merit-based opportunity, and defending women from gender ideology extremism, and restoring biological truth to the federal government. So next slide, please. These EOs direct federal agencies to cancel equity-related grants and contracts and require certifications that grantees and contractors do not promote DEI programs that violate federal anti-discrimination law, prohibit federal grantees from recognizing the existence and respecting the dignity of trans people, and otherwise restrict organizations what they can do under federally funded programs. And so I'm going to go through the myths that we talked about in the document that we worked on with you all. So, because of the executive orders, public discourse around them, a number of myths have circulated, misunderstandings or misrepresentations of what is permissible under law. This guidance frames a set of myths paired with facts to clarify what organizations can and cannot do. So over the next 2 slides, I'm gonna go through several of the myths, plus the corresponding facts and what they mean in practice. So myth number 1, next slide, please. All executive orders are valid and lawful. So that's not true. The president has the authority to issue executive orders, but that authority is bounded by existing law and the U.S. Constitution Executive orders cannot override statutes enacted by Congress. They cannot violate constitutional protections like equal protection or due process, and they are subject to judicial review. And currently, many of the challenged executive orders are being litigated. So while the administration can use executive orders to direct actions of federal agencies, they cannot rewrite federal laws or override the Constitution. Moreover, executive orders are not beyond challenge, particularly if they infringe on civil rights, anti-discrimination protections, or constitutionally protected speech or liberties. I'm going to go to the next myth. Protections against discrimination in healthcare are gone. Myth. Multiple federal laws remain in force. The Equal Protection Clause, the 14th Amendment as it applies via the 5th Amendment, Title VI of the Civil Rights Act, race, color, national origin, and federally assisted programs, Title VII, employment discrimination, including gender identity, Section 504 of the Rehabilitation Act, and Section 1557 of the Affordable Care Act, the non-discrimination in health programs receiving federal funding. So some guidance has been withdrawn, some interpretations have changed, but that doesn't mean that the protections are erased. Courts have upheld many protections. Legal precedent continues to protect discrimination based on gender identity or sexual orientation. And our next myth, organizations are prohibited from promoting diversity, equity, inclusion, and accessibility, or advocating for transgender rights. The fact is, this is simply not true. Organizations have the First Amendment rights to free speech. They can advocate for DEIA, gender identity recognition. They can run programs that promote diversity. And through lawful means, the medical providers can still provide gender affirming care in many jurisdictions. And the federal government has represented that is only seeking to restrict activity funded by federal dollars, and that is only asking grantees to certify that they do not promote DIA programs that violate current federal law. But at the same time, we know they are advancing a radical and inaccurate view of what the law prohibits. Also, ethical guidelines support equitable care, including recognition of social determinants of health, use of social history, patient-physician relationship duties, and these obligations still remain. So there are still lawful tools and approaches for health equity that you all can use at your organizations. Even in the face of restrictive executive orders, organizations still have powerful and lawful tools to advance health equity. First, civil rights protections remain in effect. Title VI, Title VII, Title IX, Section 504, which is in regards to disabilities, and Section 1557, the Affordable Care Act, continue to prohibit discrimination in healthcare and education programs that receive federal funding. Organizations can anchor their work in these statutes. Second, organizations can focus on racial neutral but equity promoting strategies. For example, targeting health deserts or low income area addresses disparities without relying on explicit racial classification. Third, another tool is the use of data. Collecting disaggregated data by by race, gender, disability, and income, makes inequities visible, and provides evidence to justify programs. Courts and policymakers are far more likely to uphold evidence-based interventions. Fourth, remember that advocacy is protected speech. Even if federal funding limits what you can do, inside certain grants, you are still free to educate communities, mobilize stakeholders, and speak publicly about those inequities. Fifth, strengthening partnerships. Collaborating with community-based organizations, civil rights groups, and health professionals helps spread risk, build momentum, and creates a stronger defense against restrictive policies. And finally, stay vigilant. Review your contracts carefully, train staff so they understand what is lawful, and document how your equity efforts align with non-discrimination law. And so the bottom line is simply that the restrictive executive orders can create barriers, but they cannot erase the core legal protections for health equity. With smart design, evidence, and partnerships, organizations can continue this critical work. Next slide, please. So what you can do. Organizations can advance equity by grounding their work in existing civil rights protections while designing programs that are both effective and legally sound. This means race-neutral strategies, such as targeting communities with greatest health needs that still address the systemic disparities, and backing those programs with clear data that demonstrates inequities and justifies interventions. I'm going to go to one more. I'm going to go a little bit out of order. So with the courts, I just want to highlight this really quickly. Several recent executive orders that I mentioned have attempted to restrict or defund related programs or gender identity and diversity, equity, inclusion, and federal funding, healthcare, and education. But several civil rights groups, hospitals, and universities immediately challenged these orders in court. Judges have granted preliminary injunctions, meaning the government cannot enforce certain provisions while the cases are ongoing. The courts found that requiring organizations to certify they don't engage in DEI work or promote gender ideology likely violates the First Amendment because it compels organizations to disavow their own values. Judges also noted that presidents cannot unilaterally rewrite civil rights statutes such as Title VI or Section 1557, that power belongs to Congress. The practical impact that is that some of the most restrictive parts of these executive orders are currently on hold, and is allowing organizations to continue their equity programs while litigation proceeds. Next slide, please. And we can skip that slide as well. Sorry, it's out of order. So as a call to action, now's the time for organizations to act with both courage and clarity. Don't let vague executive orders or political pressure silence your mission. Anchor your programs in the strong protections that remain the law, collect and use data to expose inequities, and design interventions that can withstand legal scrutiny. Speak out because advocacy and public education are protected rights. Partner with communities, civil rights organizations, and health professionals to strengthen your voice and impact. And above all, stay vigilant, review contracts, train your teams, and document your compliance so you can keep doing this vital work. Health equity is not just permitted, it is required by our values and our laws. And the challenge before us is to stand firm, stay creative, and ensure that every community has the opportunity to thrive. So, as we have seen, health equity is not only a moral imperative, but also a legal one, firmly grounded in our nation's civil rights. Executive orders may continue to create confusion or attempt to narrow the field, but they cannot erase protections, as I mentioned, like Title VI, Title VII, Title IX, Section 504, and Section 1557. Courts have already stepped in to block some of those most overreaching provisions, and advocates continue to defend patient-centered care, inclusive education, and equity-driven programs. The path forward is clear. We must continue to utilize data, partnerships, and our voices to ensure that every community has a fair chance at achieving health and well-being. Health equity is both possible and it is lawful, and it is our responsibility to carry this work forward. So to close, many of the myths floating around are inconsistent with law and precedent, and you all still have very powerful tools at your disposal to promote equity and serve patients well and challenge inequity. Thank you, and I will pass it back.
Excellent. Thank you so much, Ashley. We really appreciate you going over some of those executive orders. And we've gotten lots of feedback about this resource after we've put it out, or I think it was August when this resource went out. And I believe one of my team members has shared the link to the resource in the chat as well. So really encourage you all to look over that resource to get familiar with it. As Ashley mentioned, one of the things that we knew would happen this year as it relates to health equity and within healthcare, as it relates to health disparities, is trying to shut some of this work, this great work that's happening around our nation, down with confusion and chaos. And so that's really been a major tactic. But as Ashley mentioned, despite some of those executive orders and some of the political attacks, there are many things that remain that we can do today. So there are civil rights protections that are pretty important. Executive orders don't shut down everything, right? You can't violate the Constitution or existing statutes, some of the things that Ashley talked about. There are many core protections under the Equal Protection Clause. That's really important as well. And there's still the First Amendment, right, that protects advocacy. And so I think those things are really important for us to remember. And also just to encourage not only the folks that you work with, but other partners to not be fearful of doing this work through the confusion, but really, it's really important to learn about the facts, to not just go with the things that folks are saying, maybe some of the myths, right? There are many protections that really remain intact so that advocacy, patient-centered care, gender affirming care, and different health equity efforts are still possible. And so that's one of the main things that we wanted to get through to our audience and to our partners through that very important resource. All right, and so moving along, we're going to go over to Sue, and Sue's going to talk to us a little bit, Sue McCarron from Health Leads, talking to us a little bit about advocacy. So Sue, I'm going to turn it over to you.
Hi, everyone. Good to see you again. I'm Sue McCarron. I'm the Vice President of Communications for Health Leads and the Comms Lead for HECC. I'm based out of the Boston area, so shout out to my New England peeps. And I'm actually here, I'm going to shift gears a little bit, and I have to be honest and say that it's a little bit cringy as a comms person to show slides that are mostly words. That kind of goes against my ethos of just how to present. But what we're going to drop in the chat is a document that we started using internally at Health Leads, and we felt like it was really something that we could share with you all, that you could take and customize for your organizations. So what this really is just, it's a sample. Because what we started to realize is that as a 501c3, there are some limitations and some questions around, like, what are some things we can or cannot weigh in on externally? How might we behave in terms of communications? And there's like no lack. So that's one part, right? There's like a legal part, but then there's like a advocacy and thought leadership part where it's like, we're kind of in an avalanche of really harmful, scary policy change right now, like since January in particular. And it's kind of hard to know what to weigh in on and what to let go. And so Health Leads works in a range of different health equity issues. We work in maternal health and food security. We've worked in housing, vaccines, right? We've got a lot of things that we touch. But there's so much happening that it's sort of hard to know when to weigh in and when to hold back, right? And so we created this document with that intention for us to get aligned internally. And I don't know if this is a problem that you will all feel, like that there's so much happening, and that even within your own organization or in your own team as a comms team, there's a question around, do I put something out on my website? Do I communicate to my community about this? Do I say something on social media, right? There's a lot of sort of question marks around that. So this document is something that you can take as a baseline if it's useful and customize for your group. And so I'm going to walk through it section by section. And again, apologies that this is not a laser light show and it's a little more straightforward, but I wanted to be able to just have time to like explain the document a little bit. So I think we can go to the next slide. The first part of this is really about like, what are the legal limitations that we have around, nope, that's not me. So I'll talk through it a little bit while we're trying to find the slides. But the first slide is really about, the first section of this is about the legal limitations that you might have as a 501c3. So we can't directly lobby Congress as where we sit in our organization, at least. We have some limitations around being a tax exempt organization. I think you can go to the next slide. This is just sort of to ground in the purpose of the document, and anyone can customize that based on where you are in your org. But it just kind of gives an overview for folks internally in an organization to understand why we may do the communications things that we do. Okay, so this kind of gives an overview of the legal limitations. If you go to the next slide, it kind of dives a little further into what that means, like what actually can we do and what can't we do? Because there are some things that we absolutely can do, like we can issue blog posts and point of view pieces and op-eds. We can sign petitions and statements more generally about things we believe in and stand behind. We can respond to legislatures' requests to present information about an issue. And yes, Venus, absolutely, the administration is now going after 501c3s. So there are things we have to be really careful about. So as we evolve, like some of these things may change. And it also depends on the risk tolerance of your organization, of like what you're willing to say or do externally. And I think this document gives orgs and comms leaders a good framework to start that conversation, right? Like where do we feel like we can play and where do we feel like we need to hold back for the sake of protecting ourselves, protecting the community? And this is just, again, a baseline of like where we have landed that you could build from. Okay, go to the next slide, because this next part is also an area that I think each org can really customize. And this is really around setting your criteria around when you will weigh in externally or not. I think as Jacqueline listed off, there's no lack of things that are on your mind right now that are scary, or there's confusion, or things you want to share with your community. And it's hard not to want to reach for everything and have something to say about everything, but we will probably all burn out if that is the case. And we all know we're working with limited resources and time. So we really have to prioritize the top things where we think we can make the most impact as an organization. And so this document has some sample questions that we use when we're evaluating whether or not we want to go out externally with a message. And then when we even say, what does going out externally mean? That can mean a lot of different things, right? So this is not built in the way that it's a decision tree, but you could certainly translate this into some kind of decision tree, right? So if it's yes on this, you go this way. If it's no on this, you go this way. But you'll see some of the questions are, does the issue have clear related impact to our work? That seems like a no-brainer, but sometimes there are things you're going to be tempted to want to weigh in on that kind of fall outside your lane that could put you in a place where it's not the best use of your resources. And so if you go to the next slide, this kind of walks through a couple of the other bullet points that you can consider. Sorry, next slide, Danielle. So a couple other questions. Is our point of view unique and distinct? Is it additive and supportive and actionable? Are we saying something just to say something because we feel like we should? Or are we giving folks a resource, something to think about, something to do? What makes us uniquely positioned to say something here? And being really clear on this next bullet that if we do weigh in, what are we trying to influence? To do what, and in what channels are we really thinking about? So this just gives a framework for thinking about, we're going to share a unique point of view so that this group is able to do Y, or we're trying to reach these people through these channels, right? And it could be as simple as we just want to explain something to a group, right? It doesn't necessarily mean you have to say, go marked on Washington. We're saying, this is maybe a tool that you could use at this time, right? That could even be useful in and of itself. And then another part of this that we think about is who the messengers will be. So do we have folks or partners with the credentials and experience to actually deliver this? So we think really carefully about who the messenger is going to be. We can go to the next slide. And so there's a couple more bullet points in that section that you can take a look at in the PDF. And then we also include for staff a little bit of a distinction around, like, there is who you are when you're part of the organization, and there are channels that the organization will use for communications, and then there's personal advocacy, right? So we're all individuals in the world feeling really fired up about lots of things, and you may be exercising your right to protest or volunteer or campaign in your personal life, and it is helpful to have a little criteria for staff to understand, like, where do those lines blur and where do you have to be a little careful. So these are some of the criteria that we offer staff to think about. And the last part of this on the next slide is really just a sample process for what that might look like internally, right? I don't know if you all feel this, but sometimes when something happens or it's a piece of news breaks, and you want to say something, or you're feeling like ready to go out with something, that can get a little messy internally. And this is just a sample process that you can apply to help gain alignment around making a decision. Like, yes, like, okay, we went through the criteria, we think we absolutely want to weigh in on this. And then what does that look like from there? Who drafts the statement? How do the approvals work? So this gets a little tactical, but I figured we would include it anyway, because I do think sometimes that process can be a little messy, especially when you're thinking about your whole staff and wanting to make sure you're communicating to staff about what the org is going to say externally or not. So I think we can end that here, but like I said, the document, the PDF, is there for your use. And I'm really interested if there are any questions about it, or you could certainly feel free to reach out to us anytime if you feel like it's something that'd be useful to your organization, or if you want to even take it a step further, how might you build on it? We're always open to conversation about that. But yeah, hopefully that's helpful. It's something that we have found to be helpful as we're trying to be responsive, and there's a lot of urgency, it feels like, at some moments, and I think what's happening in the world is designed to cause chaos and confusion, and a process and a really thoughtful approach with this criteria really helps us all slow down to make sure that we don't have to rush. We can actually stop and be thoughtful and make sure that we're moving from one thing to the next with intention, so that whatever messages we're putting out are really landing in the way we intend, and are building community and strength and connection, and not adding to the chaos in some way. So I'll end that here. Apologies that my slides were a little boring visually, but let us know. Feel free to definitely reach out. We'll have this document for you in the follow-up materials, and definitely let us know if you find it useful, or if you think that you'd like something else. I think there's other resources that we're always willing to partner on and build with all of you. So I'll turn it back to Jacqueline.
Thank you, Sue. Sometimes talking about communications, it takes a lot of words, right? So a slide of words, I think it's all right. But really appreciate you sharing that advocacy guidance tool. And it looks like, from the emojis and things in the chat, it looks like others have found that helpful as well. So really encourage you all to use that tool to make it your own, to adjust it or adapt it as needed for you and your staff and the work that you all do. Do we have time to take a question, or do we want to wait to the end? Just looking at my team. Do we have time for maybe one question, Sue?
Yeah,
we shared a lot of resources. Okay.
Yeah, we could pause. We could pause here.
So we've talked about a few things. We talked about the HealthBegins health policy tracker. We've talked about the myths versus facts tool from the Legal Defense Fund around the executive orders. And we talked about some advocacy guidance as well. Are there any questions that maybe a very pressing question that anyone wants to ask, you can maybe raise your hand or put it in the chat. Venus, yes, good to see you here. Hey.
Yes, I'm still here, man. I'll tell you, this has been just a very challenging. Here I am in my golden years, or what, platinum years already, but I'm still kicking. But I wanted to find out, like we say in Spanish, y ahora qué? I have this information. Now what? What we need walking papers, we need talking points, we need something to be able to share with our promotoras and community health workers, because especially in the border, they are inundated with so much misinformation and they don't have anything to come back to. So we need to start looking at maybe having a playbook that is step by step. If you went into this is what your response should be, and try to guide them, because many of our promotoras are really lost, and our grassroots organizations, our partner organization, are pretty much giving up. I mean, this is Texas. So I don't know what's happening in the rest of the country, but Texas we're under siege here.
Understood. Thank you for that question, Venus. Do any of our speakers want to take a pass at responding? Sue, I see you're off mute. Go ahead.
Yeah, and I'll just say hi, Venus. It's so good to hear from you. I'll just say that absolutely. I mean, there's like no shortage of needs for talking points on all sorts of issues. And I think one of the things that we could do, because I know that exists in different pockets. And I think what's tricky at times is, I think base talking points are clutch on a couple issues, right? So that we're all kind of leaning in on the same messaging on some things. And then I think there is a customization portion of that, depending on who's sharing it where. And maybe what we can do from here is do a little compiling of that research, because I know some groups have already pulled some of that narrative together. Like the Opportunity Agenda comes to mind for me as one outlet that's doing that work. There are many others. So maybe the work of HECC could be like pulling together from all sources, right? Because what we don't want to do is recreate the wheel. I think there are some really good baseline talking points. And this is sort of the ethos of HECC from the very beginning, was like to be sort of a centrifuge in the middle to kind of pull in like where those talking points exist. And so maybe we could be a collecting point for that. So that's just something I'll hold and think through. And I appreciate you raising that, Venus.
Yes, thank you, Venus. And thanks, Sue, for your response. I did see another question in the chat. I know we need to keep moving, so we'll try to come back to that question towards the end. But I do want to maybe shift us to the second half of our training today. And our next presenter is someone who, if you don't recognize her name in particular, the organization name is probably a name you recognize, especially if you're in the public health space, because over the last few months, the name of ChangeLab Solutions, when it comes to resources and frameworks and tools, has came up for me multiple times. So we have asked Sarah de Guia, and she's also with another colleague, another Sarah, to join us today to talk about leading with value-based communication. So they're going to talk to us a little bit about how to, no matter who you're talking to, no matter who the audience is, maybe you're talking to policymakers, your local neighbors, talking to others, in the field, maybe you're talking to a family member, right? How do you find the common ground, and how do you get your communication or your story across? And so that's what this team is going to be talking to us about. I'm going to turn it over to Sarah.
Thanks, Jacqueline. And thanks to the organizers. It's really great to be here and to be able to share our experience as ChangeLab with messaging strategies that have really supported public health over the past couple of years. I want to offer a couple of caveats for a second as we get the slides popping up. And I also want to name, there was a point in the comments there about APHA. So just dovetailing from the last presentation, every year at APHA, ChangeLab does a really long and extensive presentation about lobbying and advocacy. And it actually looks at the difference between if you're foundation funded and if you're federally funded. And there's just some really great talking points. There's like a great formula to think about and some other strategies. And so if you want to dig in and you're going to APHA, that's something that we do every year. It's our privilege to be invited to share that information. And it's a nice deep dive to be able to really ground your decision making around lobbying versus advocacy, because advocacy really encompasses a lot of different types of work that you can do to be able to move your issue across. So all of that to say, I'm Sarah Guia, the CEO of ChangeLab Solutions, and I'm joined by my colleague, Sarah Bartel, who's the managing director with ChangeLab. And I asked Sarah to join me kind of late in the game, so apologies. She's not as well represented, but I want to name that Sarah has been working really closely with our partners across the country and the Build Health Challenge and other different work that we've been doing. And she has really led the creation of a new toolkit that we're also putting out, a roadmap about public health authority. So thanks, Sarah, for joining me. The other thing I want to just sort of frame up as we dive into this conversation is, as we've talked about, we're in extraordinary times. We're still learning, we're assessing, and we're really trying to evolve our strategy and focus in this particular moment. We've talked about there's a lot of overwhelm and chaos, and that's all by design. And what that means is that we're still getting our grounding, and that we've got to have a little bit of patience and grace with ourselves and our partners in this time, because that way we're going to be able to move together. We're going to build that trust and be able to move together in these moments and really leverage our strengths. We can't all do everything at one time. We've got to really identify those strengths and those partners as we move together, which again, all of these presentations have really focused on today. The second thing I wanted to name is that communications is a phrase that also encompasses a lot of strategies and efforts, right? From translation services and marketing to even having sort of critical debate and offering feedback. It encompasses social media, marketing, lots of different things. Today's conversation about communications is going to be talking about messaging and message strategy that is really to further your advocacy strategy. And advocacy includes things like educating policymakers or others about the value and the importance of your work. And it may also mean asking a policymaker to take a position or to defend a position or particular issue. So it encompasses a lot of different things. And what we're going to talk about today are some of those strategies that can really help you formulate a message that's going to be able to cut through a lot of the other chatter that's going on, and hopefully be able to get policymakers and others to align with your values and the efforts moving forward. And then the final thing I want to say is that even if you don't do advocacy or that word kind of scares you, the strategies that we're going to talk about today, I think also have broader implications for just how you talk about your work. And as folks mentioned earlier, in a time in which communications may be sort of an area in which organizations are eliminating or sort of reducing, this can help you and your teams really sit down and think about how to use the words to convey the value of your work. So with that, let me share a little bit about ChangeLab Solutions. Next slide. For those who aren't familiar with us, ChangeLab works across the nation to address complex health challenges through the tools of law and policy. We do training, technical assistance, and produce tools that really help to address structural inequities by improving changemakers' knowledge and capacity to design, adopt, and implement those equitable laws and policies. We offer training and implementation support on the policymaking process. For example, we convene peer learning groups to share information and strategies with each other, and we develop practical policy tools like toolkits and legal memos that help translate complex policy and legal concepts into actionable solutions, including model policies, for example. And we have a very interdisciplinary team of lawyers, planners, policy analysts, and public health practitioners that bring a wealth of knowledge, both in terms of lived experience and across different kinds of health-related issues like food and healthcare systems, housing and planning, as well as good governance strategies. And just to name, we are attorneys here today, but we're not your attorneys. And so this information is for informational purposes only and does not constitute legal advice. Okay, next slide. So with that out of the way, I want to offer again a little bit of background. Folks today have mentioned the power of partnerships, and for about 20 years now, ChangeLab has worked with several other public health law organizations who have really served as a foundation for the public health law field. We have longstanding partnerships with a lot of different local and state health departments, community-based organizations, and even the CDC. And all of them often come to us for our ability to track, analyze, interpret, and offer guidelines on laws, regulations, and policies that really support foundational public health services. In 2020, as we continue to meet and gather, we started tracking the response to COVID at the federal, state, and local levels. We produced a couple policy playbooks, and we really started to dig in particular on the rollback, that we were seeing these trends around rolling back public health legal authority. And we also began to do this sort of on an ad hoc basis, and then we're able to get funding to be able to track it more formally. And so I'm going to talk a little bit about some of the results of that. But what we heard over and over again was that people needed support to just talk about public health generally. What is it? What is its value to people and communities? But specifically, we needed help talking about what is public health legal authority in particular. And we needed to be able to convey with elected officials in particular, though also other partners who are either trying to defend public health authority or who are attempting to roll it back, right? And so we worked with the Berkeley Media Studies Group and Real Language to create some resources and tools to be able to do just that. This is a little bit about some of the trends. So the next slide is some of the legal shifts that we began to see in public health authority, which were really having a negative effect on people being able to respond in real time. So on the next slide, you'll see some of these trends, and we have some other resources that kind of go in depth about it. But things like preempting local governments from being able to distribute vaccines in a particular way. We started to see shifts also taking away authority of public health officials to do their job and then putting it in the hands of the legislature, which doesn't have the kind of training and evidence-based practices that we all have. We started to see the exemptions to public health measures be broadened in particular ways. That was all happening sort of legislatively. And then we were also battling things in the courts, right? Folks were taking different government officials to court to be able to challenge things around free exercise, the kinds of evidence that were being used, and in general, just really kind of threatening the authority of agencies to be able to do their work as well. And so these are the kinds of things that we were responding to in this particular moment. Okay, next slide. So as I mentioned, to help Act for Public Health and ChangeLab and other partners in local and state health departments be able to respond to this ramped up challenge to authority, we worked with Berkeley Media Studies Group, who's been around for over 2 decades. And they specifically work at the intersections of communications and public health. So we didn't have to do a lot of explaining about public health to them because they really got what we do from the beginning. And I do want to name that this presentation draws heavily from their work and the reports that they produce, which are all linked and are available for you all in the resource section at the end of this presentation. One of the first things that they reminded us of is that your messaging strategy is just one of several layers of your overall strategy. And so you want to get really clear on, as an organization or as an advocate, what is our overall strategy? What are we trying to do? Are we trying to prevent something from happening? And what is that? Are we trying to advance a vision forward? Are we trying to get funding to stop being cut, etc.? So like, what is the strategy? And again, mentioning at a time in which that may feel like it's coming at multiple different directions. The reality is that your messaging strategy can really has to align with one of your overall strategies, right? You may have to have multiple messages that attach to multiple strategies. So these are some of the questions that you might want to ask yourself as you're thinking about that. We're going to talk a little bit about creating your message strategy in particular. And some of the layers that we're going to talk about today include things like, what is the issue about that you want to talk? What's the framing here? What is it that we want to say? And then there's some other considerations like, who is going to say this, right? You want to think really critically about that. The target is really important. Who's your audience? Who needs to hear this message in particular, because they're going to be able to take that action that is going to further advance your strategy. So the next thing that I want to talk a little bit about when we're talking about our message frame, or when we're talking about the message strategy, is to consider the message frame. So let's go to the next slide. Message frames are these mental pathways that get stronger for folks over time as you continue to repeat your message over and over again. And how you frame the message really matters because it shapes how your audience is going to understand what is the problem, who is responsible, and what needs to be done in order to fix it. So in public health in particular, we often have to contend with this challenge, right? The individual versus the common good. That is just the overall challenge that public health is always going to have to kind of contend with. So this notion of the rugged individual, right? The person that they're going to solve their own problems. That is something that is like a deep rooted sentiment that we are going to consistently have to think about when we are framing up our message. And so the way in which Berkeley Media Studies Group talks about this is, hey, you've got your portrait frame, which is really zooming in on this particular individual to tell a story or their particular story, right? Storytelling is important. If it is only framed from this individual's perspective, right? Look, if you look at the landscape picture here on the slide, you can see I've zoomed in on that one person sitting down thinking, and you miss the bigger, broader landscape that we want to convey, particularly as public health, which really relies on systems and policies and laws and regulations in order to be able to affect and create an environment that everyone is going to thrive in, right? And so when you're telling your story, you want to be really careful about that message frame because it can you can inadvertently sort of re-emphasize that notion of rugged individualism, and you can obscure then the systems and the policies that are creating those conditions in which people live. And that can be harder for people to understand why public health is essential for all of us, right? So BMSG's work really helped us to respond to the legal attacks on public health by framing the conversation in a bigger landscape, the systems and the conditions that support our overall well-being and our overall collective, right? And that really comes through when we talk about the values and the principles that reinforce that interconnectedness and the duty to one another. And we all as public health folks recognize, right? There's a duty in public health to be able to support each other. And so focusing on that landscape really helps us to reemphasize our shared responsibility for health. That includes giving public health departments the authority to respond in times of public health emergencies. So when our messages are repeating and reflecting that landscape, we're reinforcing the landscape frame, and that public health is indispensable for a functioning society. So let's dig in a little bit deeper and talk about how they recommended some of the recommendations for how we communicate health. So in the next slide, this is really, again, I also want to name that like Real Language, which is a group of neurolinguists, worked together with Berkeley Media Studies Group. And they actually studied how public health was being communicated at that particular time, and also a little bit more broadly too. And then they were offering some recommendations to help us pivot and communicate differently. And while these are recommendations for public health authority, I do think that they are actually expand beyond just public health authority, and that they're really useful for just how we communicate things right now in this particular moment as well. Sarah and I are going to walk through each of these. I'm going to start just kind of framing up the issue and then hand it to Sarah to talk about the first two bullet points. So let me just first say again, I'm just reemphasizing that letting the strategy dictate your message is the thing that we've been talking about. We also want to frame up public health as indispensable, portray public health as competent and confident, use plain language, and describe how our bills, lawsuits, or whatever actions are taking block public health from doing their job. So let's go to the next slide, and I will hand it to Sarah to take over.
Thanks so much, Sarah. when we think about metaphors for framing public health as indispensable, what that enables you to do is to tap into those pre-existing frames, those pathways for understanding that are already in the brain. And so it's a much more efficient way to get your point across. And so for health and public health investments, one favorite metaphor shared by our expert communications partners is firefighting or a fire department. So in most places, a fire department is a positive governmental model where we have pooled our resources so that we're protected since nobody can put out fires on their own. And so you've also got elements of emergency response and prevention and education. You've got firefighters who are teaching in schools, who are providing services for tree maintenance and checking fire exits and fire code violations, making sure that we're all safe. Other metaphors include like insurance or car maintenance. So when you let it slip, you miss the chance to prevent bad things from happening. You miss opportunities to catch things early, and then bad things are more catastrophic and costly when they do happen, right? These are the metaphors that we want to establish for health and public health investments. On the next slide, you'll see highlighting the public health's strengths. And this one is interesting. I think rather than framing things up as a crisis, talking about a broken system, the erosion or fragility or weakening of the system, that can lead to feelings of hopelessness. What can I even do? Something I think we're all feeling very much right now anyway. Or it can confirm people's beliefs that the system actually isn't worth improving or saving anyway. And so you want to emphasize mission and capability even amidst the struggles. So what public health and health infrastructure does, how it faces the challenges, rather than opening by emphasizing those challenges. And you can focus on the individual players and staff and partners and their roles, and no strength is too basic, right? Especially right now, where we know that so many people have forgotten or never really understood what public health does in our day-to-day lives behind the scenes and publicly. And one thing that comes up when we talk about public health strengths and leading with that asset-based framing is like, well, what about mistakes, right? I think about the opening principles that started this call. How do we talk about our mistakes? How do we own our part in perpetuating inequities? And I think the emphasis that has come through conversations around using this guidance tool is it doesn't require being blind to mistakes or shove them under the rug. This is about leading with strengths as a way to contextualize that necessary step of owning one's role in historical and or ongoing harms. And if you click through, I think maybe one more, we've got a couple that'll unfold in this. Oh no, I thought there was an example there. But especially during COVID, I think a lot of communities were wanting to own things that hadn't gone as perfectly and still like make the case that their work is very important. And I think the guidance from BMSG and Real Language is just like flip the order and lead with those strengths, lead with those capabilities. There we go. Okay. Sarah, I'll hand it back to you for the next slide, I think.
Thanks, Sarah. So we'll advance the next slide, and then can you, as you advance it, can you go ahead and, yep, there's some, perfect. So the other point of advice that was given to us is that we really need to use that active and decisive language. So oftentimes we want to say, well, the guidance says, or the recommendations are. When we're talking about our messaging strategy, we can't sort of beat around the bush. We've got to be really active and really decisive. And so we have to use words like we deliver vaccines, we prevent the spread of disease, we protect public health. And this demonstrates that we're taking action rather than sort of sitting around kind of waiting for things to happen and then we're jumping in. And so here's a perfect example of that. Early in the pandemic, our public health workforce jumped right in to protect essential workers. And then they stayed on the trail of the virus and strengthened guidelines to urge mask usage. So really providing that active framing showing the decisiveness of the field, it really illustrates the training that we have, the expertise that we're bringing to the table, and the fact that we are there to support everybody in this particular moment. Like, we know what the plan is, and we're there, and we're going to be taking action to be able to do that. The other thing that BMSG recommends is to use images that also convey this idea that we are in the community, we are one of you, and we are connected to you. And so rather than using things like the shot in the arm or even just a picture of shots, right? We want to actually show people in the community doing the education, being a part of, doing the like day-to-day kind of work, right? Rather than just sort of putting the shot or the shot in the arm, which then actually evokes the medical care field anyway, right? It doesn't actually do us any good. And so using that decisive language is really important. The next slide, which again has animation, so I'll encourage you just to kind of hit the button and advance forward. Thank you so much. One more time. Perfect. So then you want, now, okay, perfect. So then what we want to do is we want to talk about and use, again, this sort of active language to talk about the problem. So as Sarah mentioned, like, you don't want to skirt away from the problem. You don't want to skirt away from mistakes. But in this particular case, you really want to talk about what is happening in this particular moment that is preventing us from being able to do the job. So using things like it's blocking our ability to do our work, it's not allowing for, it's taking over or taking away. This elicits for your audience the feeling that something is being taken away or being prevented, and people don't like that, right? And so in this case, it really allows for it like lifts up the benefits that public health provides these things in order to keep people healthy, like safe food to eat, clean water to drink, safe and affordable medication, right? And at the same time, it's lifting up, this is the problem or the challenge. And so, right, this is the great statement. Our duty in public health is to keep Philadelphians healthy and thriving. This means responding to new developments that could cause harm. We do this all the time, especially in times of crisis. The lawsuit would tie our hands and leave us unable to respond. We've asked the judge to dismiss the case so that we can focus on the well-being of Philadelphians. So I know as an attorney, sometimes you want to get into the jargon or the technicalities. And in this case, you don't want to do that because then it's already starting to sort of keep people away from really understanding what the problem is. So you want to use that plain words while also being very clear about what your problem and your challenge is. And then just to mention, this is also a really good way to use that metaphor once again. So some of the other phrases that you can use is, it's like the legislature telling fire departments that they must keep putting out fires, but also passing a law that takes their authority away from being able to tap into fire hydrants, right? Or it's like the legislature piling into a bus and parking it in front of the fire hydrant in the middle of a 5-alarm fire so the department can't get the resources to get their job done. So it's using different words to actually convey both the indispensability of public health, the challenge, and also the solution. So I want to go to the next slide because this is a beautiful diagram that BMSG has done that actually shows you where the values are being named. And I love that it's like a sandwich, right? They're the top of the bread and the bottom of the bread. And in between is the solution, right? These are all the best ways that, public health is able to help you in a crisis. And the problem is very succinctly stated in the middle of that. And then I think it's like, that's why we ask the judge to dismiss this case so that we can then focus on the values. So this is, again, a way to put your challenge and the solution together, but really surrounding it by your values. Now, not every message has to be like this, but I think this is just like a really nice model for people, particularly who are visual learners. I'm going to talk quickly about so if we can go to the next slide, and again, there's animation, so if you can just advance to those. When you're in discussion with people, here's a couple other things that are really super important. First of all, you want to avoid repeating your opponent's arguments. So instead of reiterating what they're saying, you want to try to acknowledge that you've heard them, but then pivot back to your core message, right? So one of the things you can say is like, this is an evolving issue, but what is clear now is, and then go back to your core issue. I'm hearing that question a lot, but what I want people to take away is, X. Some people have said that, but what the evidence shows is Y, right? And so you really want to make sure that you're not actually saying, well, I have heard evidence in which people have been saying blah, blah, blah. Don't repeat your opponent's arguments. Instead, pivot back to your core message, right? The other thing is, in these message strategies, we're not going to be able to answer everyone's questions all the time. So in fact, I would say you want to actually be really clear and succinct about what is the most important part that you want to get across in this particular message, because you're not going to be able to counter every particular argument or introduce new information into this moment, because then you're just going to throw everybody off, right? So you want to be, you can have research that backs up with the Q&A. I think that's really essential and critical, but we don't want to sort of, again, repeat our opponent's arguments, and we don't want to introduce new things. You want to keep coming back to your core message over and over again. And then the final thing I'll say is when we can't, so the next slide is kind of how did it work? So one thing I'll say is we haven't been able to track the direct results, like using this message, these were the results because things were moving very quickly. But what we did see is over time, legislative trends downward towards the introduction of authority to introduction of bills and legislation to counter authority. And what we also saw is that even in the first year, for example, like 1,500 bills were introduced, but only roughly 200 were actually passed or enacted across the nation on a variety of different issues, right? In the second year, we saw even fewer introduced, and then over time, we've continued to see sort of less and less bills introduced. And the thing is that we've started, there were cases, and Sarah can also speak to this too, there were cases in which, particularly challenging communities were able to prohibit stop or block those bills from passing, as well as the court cases as well. So what we wanted to do in the last couple of minutes is we want to actually have you take a few minutes to start to think about and incorporate and apply this messaging strategy in this particular moment. We often find, you can go to the next slide, it's baseball season in my house, and so I threw the practice gear up here for baseball. But so in these moments, like after you've kind of gotten information, one of the easiest things or one of the best things to do to really solidify this is to actually practice it. And so we want to take a few moments to have you break into small groups, and the team is going to tee up some small groups for us. And then we want you to take a few moments just to try this out. No good enough for now mentality, nobody's perfect. Just try to apply thinking about, one, what is your timely issue? Two, what is your audience, the target that you're really looking for? We want you to start thinking a little bit about those core questions, that formula, right? What is the problem? What is the solution? And what are some of the values that may resonate with your target audience? And then just give it a try. Try to draft a message. In your small groups, we will ask people to kind of give each other some feedback, practice some vulnerability in this moment and some courage, and throw it out there, allow for people to sort of offer you some different insights. And then we'll kind of come back, and I would love to hear from folks like, how was that response? So while folks are breaking us down, maybe just take a few minutes to think about your timely issue and answer some of these questions on your own. I can also be here, Sarah and I can be in a different room to answer questions as you come along, or as if you need, like, hey, can you go over that thing again? So we're here. Yeah. We're teeing up this opportunity to practice in this particular moment.
Excellent. And folks will have about 5 or 10 minutes in their groups. And I believe you should see the button to take you to your group. All right, welcome back. Welcome back. All right, Sarah, we should have everyone. Well, I still see pictures popping up. Hopefully everyone got a little practice in, maybe some feedback from your group members. I'm going to turn it back over to Sarah.
Thank you. Yeah, so I'm curious, how that went for folks, if anybody would like to share their message, or even talk through sort of your strategy, but we would love to hear from you if you want to share a little bit about where you landed. I'm also happy to field, Sarah and I can also field questions too, if that's also helpful. Oh,
I
great.
can go ahead and share. I could not find the raise hand. Sorry. I lost our group because we were sharing something and then we run out of time. So I want to honor everyone that was there, Heather, and I'm trying to remember everybody's name. I forgot. Ellen? No. Well, you know who you are. Sorry, guys. But we did share about one of the programs that we shared about is related to working with Medicaid programs across states, and how the problem is, how do we transition into using the correct language to state the positive health outcomes we want for all, and that the importance of recognizing that in order to continue to do this work, even when there are geographic differences across the states, and the values that resonate for some states may be different than others. So that's important. So yeah, the problem of words, I would call it that way. What is the solution? Of course, we fix all the problems in 5 minutes. What is the ask? We just didn't get to that point, or what values resonate. But I did speak some from just for some of my experience being, I can use all the different words, but this is how I look everywhere I go. So I learned English later in life, so it's harder to do the switch of words, and then like I have mastered some, so now I have to master different ones. And recognizing that it could be different for different generations of professionals in this field. I feel like I probably have more courage because, I'm closer to the end line, I guess, than younger professionals who are in this role, and they have to kind of sustain the gaslighting of this situation, right? Like it's just, they have to adapt. Otherwise, they will not be able to continue to do this work. So that's it. I'm sorry. I know we probably had more to say, but we ran out of time.
Thank you so much for sharing. And some of the things that got evoked as you were speaking was the idea that like we live and work in multiple different communities, like in a regional space, right? That health knows no borders, that it's really important for us to be and stay connected where we are. And so having these false limitations or having these boundaries around access is really affecting our ability to be able to support and help each other, or something along those lines. So yeah, I think you're getting to it, right? Naming the problem, starting to really think about what are the values, like what are the people, your target audience, what are they going to hold deeply for themselves to be able to kind of tap into that particular feeling as well. So thank you for that. Sarah, do you have anything else to add and reflection? And then I see Courtney, your hand is up.
I dropped into the chat that I think a lot of our communications experts are out there categorized in different ways. And so when you talk about wearing these different hats and the different rooms you're having these conversations, it can be helpful to think about kind of defining your case along those different angles. So the different audience that you're talking to, the different issues you reflect, the values, and that can be a helpful way to identify what's already out there.
Hi, everyone. Thank you for that wonderful presentation. ChangeLabs. Sarah, I met you guys at APHA. I have to go because I'm I'm one of the chairs of the policy committee for the APHA CHW section. You guys, oh, you're both Sarahs. You all do amazing, amazing work. So Jacqueline, thank you for bringing them on. My question is about, I would love to see like what we can tap into, and I know Jacqueline's working on that, but really I think how we strategize is so important, and understanding who is in the room, because there are so many of us who are amazing leaders in other spaces, and we have hidden jewels. Like, each relationship contains resources. Those resources are hidden jewels, whether they're soft or hard resources. And so I just want to lift that up. I had an amazing room, and it was too short. And then, it was really, really good what we were talking about. I also wanted to offer some space to lift this up, that we're doing a Robert Wood Johnson Foundation Health Policy Research Scholars, and all 5 programs is doing a get together summit. I just came on as their social network weaver / community manager to build across the 5 programs and inside HPRS as well as nationally. If anyone is interested and is coming to the event, please let me know. I'm looking into doing a get together with different organizations on it. And then Jacqueline, I've also talked to Jacqueline about it. So you can also go through Jacqueline as well. And I'll be working with her on that if there's interest in it. Oh, or we could do a really informal dinner as well. You're welcome. Thanks, Jacqueline.
All right, and I apologize. Courtney, let's go over to you.
That's okay. Can you hear me now?
Yes, I can hear you.
Oh, wonderful. Hi, Courtney Clay, Shehar, Illinois Public Health Institute. So my group did a really wonderful job at our practice with answering our questions. We decided on our timely issue being access to healthy food, with our intended audience being those policymakers. We really identified those core questions, that problem being access to affordable and nutritious foods in food deserts, with the simple solution that we proposed being that we need a grocery store in the area. And so our ask was to these policymakers to incentivize producers or store sites to sell in these locations, and additionally require that they promote the programs that they have to individuals in the community. And the values that we thought would resonate with our audience was cost savings, including chronic health improvements, reduced costs of transportation outside the community, and sustained employment and community market. We did not, however, get to drafting our message, and I'm wondering if you all have any thoughts there or any tips related to when you have such a big problem and such a huge potential impact for the community, how you can synthesize that and reduce it down to a really clear and concise message.
Yeah, I know it sounds really hard. And I think it's going to be a process, right? You're going to have to keep refining and refining and refining. I will say BMSG has also put out a number of tools recently connecting the SNAP Ed cuts and health and like its impact on public health. And so that may be another tool. And I think we can probably find it. And if we can't get it to you right now, we can get it to Jacqueline, who can share that. But it's really about, again, sort of using that, just keep distilling down and down and down until you're using those really active phrases and like eliminating that technical jargon. But what I love about what you talked about was that you tied the value to cost savings and economic security and workforce, right? And those are values that are we have seen those values resonate in a bipartisan way. And Indiana is a great example of that, where they created a commission that is actually did look at, made recommendations, and then funded core public health services. And the roadmap that we are also putting out has, again, some examples too of the ways in which those values are getting across as well. So I think you're like on the track, and I'm really excited that you were able to like find an issue, talk about it, identify the solution, talk about the values. The next phase is just like doing the hard work of like refining and refining and refining, but like really good job. Sarah.
I think too, I would add, like, don't take it all on yourself. Like, get as many partners in the room as you can, get aligned on who's going to cover what, and delegate.
All right, Sarah, I think we have time for one quick response. So if we can we go back to Ramona? She mentioned in the chat that she wants to share what her group talked about.
No, not me. Talbot has it. I was just trying to say that so we don't run out of time.
Right. No
and
problem.
Then pass it on to Talbot. But Courtney came on. Talbot, if you're there, feel welcome to share out, because I know you have the notes. I don't have them.
Oh, I do.
we were just talking about, we kind of focused specifically on language and how that can feel like a trap. And so I just shared, and I don't know if it's shared in like the whole chat or if it's just in the group chat, but like an article that I've shared widely is just like linguistic suggestions for continuing the work. And I think that as communicators, we definitely have an opportunity to be creative and come up with new ways to talk about the work and keep doing it in a way that won't be flagged by Doge's web crawlers that are looking for, you know, the list of keywords that they don't like. And so that's been my suggestion to people, is that don't give up the work, don't feel trapped, use your creativity and come up with synonyms. Like use a thesaurus. It's a great weapon against fascism. In this case.
Oh,
Thank you,
100%.
Talbot.
Like that was amazing. Yes. So as I close out, I think one of the things I want to do is like, please go back and look at the slides, download the report. And I think the thing I want you to like walk away with is that there's kind of a formula that you can use. And so you don't have to start from scratch. To Talbot's point, like there's other resources. Sarah dropped in a resource from Frameworks Institute that's sort of trying to combat this like rising idea around using evidence, like not supporting evidence or facts. And I think those are also opportunities. And just remember, like your message is about what is the thing that you want to convey in this particular moment. And you may have stories that back up why this is important in this particular moment, but your message is about getting across the solution that you want to see, and that your solution is actionable, that it is attainable, and that it is going to lift up the entire community as a result of it. And that's really the messaging strategy that I want to make sure we all kind of leave with, and like that important role of messaging as well. So with that, thank you so much, HECC and Jacqueline and team. It's been great to be here.
Yes, thank you, Sarah Guia. Thank you, Sarah Bartel. We apologize for not introducing you properly, but really appreciate the information that both of you shared today. Please do check out the ChangeLab Solutions website and all of the resources that they shared today. And some of those will be linked in the slides that we share afterwards. I really appreciated the 5 recommendations, right? Let the strategy guide you, making sure that you ensure that you mention that public health is necessary, right? Using active language, using plain language. Venus, our partner Venus, guidance has shared in the chat that plain language is really important, especially when you're thinking about translating it to another language. And then just describe how other actions may hinder some of your public health work, right? That's really important. So really thank you all. I do apologize that we did not have a lot of time for questions. We always plan these things where we're like, we need to have some time for questions. And no matter, how much time we plan for questions, we don't have as much time as we would like. So please feel free to message us later with questions if you do have any that come up. I just want to say thank you all so much for being here. I was listening to something earlier, and Michelle Taylor talked about how, as public health advocates, you really have to want to be here. And I thank you all because you all have been intentional in wanting to be here today. You could be anywhere else, but you have chosen to be with us and to gain from these tools that were shared. So really, thank you all. Thank you to our amazing presenters, Sadena, Natashia, Ashley, Sue, and Sarah Guia and Sarah Bartel. Thank you all so much. We have shared a Zoom poll, so please complete that. You'll also get an exit poll when you close out of Zoom. If you missed part 1 and you want to catch that replay, it is available on YouTube. We also have the link in some of our follow-up materials. You'll get the recording to this link, the tools today, other resources. And if, you may have heard as well, if you attended the first session, you attended this session, if you attend the 3rd training that we have, you'll be invited to participate in a comms working group, just a space to keep practicing. And so we hope that you will be a part of that 3rd session as well. And we have a few things on the screen today. A couple of which I've already mentioned. The last one is that on October 30th, we'll have a Health Equity Community Collaborative community gathering, and that will be focused on the topic of rural health transformation. So those sessions are typically for connecting, and in this one, we want to connect, but also talk a little bit about what's happening in the rural health space. There's a lot of conversation there, much to share, much to talk about, so please sign up for that as well. All right, we are at the hour again. Appreciate you all so much for your time today, and we hope to see you next time and enjoy the rest of your day. Goodbye, everyone. Thank you.